Jamaica has recorded 21 confirmed cases of Zika transmission. This follows the discovery of 5 new cases since June 2, 2016. In his address to Parliament on Tuesday, Jamaica's Health Minister Dr. Christopher Tufton says the 5 new cases recorded were primarily from the country's capital city, Kingston.
Of the 787 which were tested, 480 results have been received, of which 21 were positive for Zika virus. 2, Mr. Speaker, of the 21 confirmed positives are pregnant women who will be continuously monitored. Mr. Speaker, as we have been pointing out, we estimate that the number of confirmed cases is just a small portion of what is actually the reality in terms of the persons who have possibly been infected. The WHO indicates that as much as 70% of the population of a country may be infected over time. This is a country which previously did not have the virus present. Only 1 out of 4, according to the WHO, of the infected persons will have symptoms. Up to 50% of symptomatic persons may be sick enough to need to see the doctor. Fewer still of those infected who visit the doctor will have their blood taken in order to confirm Zika virus infection. Of the persons who are ill, only about 1 in 1,000 may have severe symptoms, again based on WHO research.
Tufton notes that 75% of mosquito breeding sites are in homes, specifically in large water storage tanks. And with that in mind, the ministry will institute the use of the tiki-tiki fish to remove mosquito larvae in large water storage containers. In the meantime, the Ministry of Health is calling on the support of members of Parliament to strengthen environmental control strategies at the community level.
The Ministry of Health, through the National Health Fund, will be providing $1 million to each MP, member of Parliament, to support Zika activities at the constituency level. The funding will be channeled through the Ministry of Local Government and Community Development and will be available as of July 1st, 2016. The money is to support, Mr. Speaker, intervention through the end of August 2016. And activities are to be focused in high-risk areas. Mr. Speaker, as a breakdown of how the funds will be used is as follows. Firstly, training of 1,000 community workers through the Heart Trust NTA under the guidance of the local medical officer of health. This training will utilize some modules from the existing Community Health Aids Manual. We expect, Mr. Speaker, that this formal training will allow us to have a core group of persons that we can call upon for similar activities in the future. These workers will be employed for 6 weeks in the first phase, beginning July 1st, 2016. Secondly, facilitate community and town hall meetings working through agencies such as the Social Development Commission, Neighborhood Watch, and other community-based organizations. This will begin in 2 weeks, and we will be partnering with the private sector in this regard. Thirdly, undertake vector control activities, Mr. Speaker, at the community level, and the aim of reducing mosquito breeding sites. And thirdly, as usual, disseminating educational material.
Mr. Tufton is appealing to Jamaicans to continue using approved home remedies to rid their surroundings of mosquito breeding sites, as the current increase in rainfall is expected to spike the mosquito population on the island.